Hey guys, I'm here with Greg, and we just got to his very first progress check, and he is doing incredible. He's come a long way, and we're just gonna kind of talk about where he was in the beginning and how far he's come. But I wanted to show you his x-rays first off. And so if you can see this, these are giant screws in his back. So he had a fusion in his back. And how long ago was that?
Last August.
Last August. So, okay. So what was going on before the fusion? Like, describe the symptoms. How long had you been suffering for? And like, how did it get to this last resort where you needed surgery?
For about 3 years, I hurt, so bad where at times I couldn't hardly even walk.
Man.
And it affected everything in my life.
We have a manual job. Like, you drive and you have to like bend and lift and do a bunch of stuff.
I'm maintenance over 6 facilities.
Yeah.
So it's constantly up and down, climbing, crawling.
Yeah. And how was that with that kind of debilitating pain?
It hurt so bad that I would have to stop about every hour and sit for about 30 minutes to rest and then go back to work.
Kind of hard to be efficient with that kind of pain.
Yeah.
But you're so tough, you
Yeah.
just toughed it out anyway. So, but it got so bad where you just couldn't take it. You went in, you had the surgery, and kind of describe like how did the surgery go post-surgery? How did you feel? And then obviously like there was still some significant issues. So kind of walk us through that process.
Before the surgery, I had severe muscle spazzing in my back.
Okay.
Bad. I mean, it would spaz probably 100 times a day.
Oh my gosh.
After the surgery, it went way down, but it didn't quit.
Okay.
And then when you came and did the seminar at my job where I work.
So we went and did one of our Wellness Within community outreach programs. We did it on toxicity, I think.
Yes, it was.
I did toxicity webshot, but I talked about the body's ability to heal. We talked about some spinal stuff, and then you caught me at the event, and you were kind of walking me through your experience and your history. And even while he was talking to me, you could see that the back hurting because you would get these catches.
And I'd have to lean against the wall to catch myself.
Yeah, he could barely stand up. It was still hurting so bad, and this was still like a daily thing almost.
Right.
And
and sometimes it would spaz so bad and hurt so bad, it would just take me straight to my knees.
And this was after the surgery.
After the surgery.
And so the surgery, obviously there were still tons of debilitating issues, some chronic pain, and so you were like, hey, let's go check this guy out. And so you came in, we did the evaluation, we took the x-rays, we assessed the damage, and above the area of fusion, there were some really bad misalignments that were causing some damage, some wear down of the joint, the disc was getting damaged. And we did a pretty intense corrective protocol. And we did 3 times a week for 4 weeks. We did 12 adjustments, and we just did his progress check. We re-examined, re-x-rays. We're actually seeing some really good change structurally. But again, let's talk about how well you're feeling.
Yeah, at times I have no pain at all now.
And when's the last time you were completely at a zero?
Last week.
Well, I meant like before getting
that,
adjusted. It's been years.
5, 6 years.
5 or 6 years being in pain, and then finally he gets to a point where he's even at a zero sometimes.
Right.
That's awesome. And you even went on vacation. You felt awesome.
Went on vacation, had no pain, no problems the whole time I was gone until I come back and go back to work.
And then he did some stuff.
But it still never gets above a pain level of 3.
So even with all the hard work, the driving, the bending, the lifting, it gets to a 3 at most.
At most.
Way more manageable.
Oh, a lot more.
And then you come in and get adjusted and it goes away.
Yeah.
So, vacations are awesome without any pain, right?
Oh, yes.
Life is better with less pain.
Yeah.
So, anyway, we just an amazing testimony of the body's potential to heal. So, if you know someone who's in that kind of pain, even post-surgery or maybe even pre-surgery, like who knows what could have happened if we would have found him beforehand and maybe prevented that. But again, we just want to share that story because somebody's out there needs to know that, again, Max Living, Corrective Care Chiropractic has all the potential to heal, even if we're in that bad of shape.
Very much so.
Cool.
I totally believe 100%.
Well, seeing is believing there.
That's right.
Okay. All right, guys. Thanks for tuning in. We'll talk to you later. Bye.